Lymphatic drainage and association. It's a one of an important topic that always asks about a metastasis, enlargement of lymph node, lymphadenopathy, a lot of things. If any infection happening, which lymph node is included, it's a very important thing. But how you will be remember, just imagine your body and touch all the surfaces of your body when I will ask you. First, you have to touch your mandible bone, and below the mandible there will be submandibular or submental lymph nodes. If you come below this submandible, if you guys come below, there will be cervical area, and any lymph node present cervical area, it will be deep cervical lymph nodes. These are clavicle, and above the clavicle there is a lymph node. It will be supraclavicular. This is the mediastinum, and any lymph node in the mediastinum will be mediastinal lymph node. There is a hilar of the lungs, and that lymph node will become hilar lymph nodes. That is a axilla. Axilla part of our arm. So any lymph node is there will be axillary lymph node. And after that, there will be trochlear part of the image, there will be epitrochlear. But below the hilar, it will be very easy. If you guys know about the GIT, there are 3 sections according to embryonical derivative: celiac, superior mesenteric, and inferior mesenteric. Same like that for the GIT, in above we having the celiac lymph node, then superior mesenteric, then inferior mesenteric. But between the superior and inferior there is the umbilical. So umbilical lymph node will be para-umbilical lymph nodes, and they were second name Sister Mary Joseph node. There is the aorta. In near the aorta there will be para-aortic lymph node, iliac. Outside the iliac there will be external, inside the iliac, internal iliac lymph node. There will be inguinal ligament. In the inguinal upside there will be superficial inguinal ligament. And there is in the leg there is a popliteal fossa. There will be popliteal lymph node. It's so simple. First memorize the name of a lymph node, so it will be very easy to palpate. But all the things are related with their position. Okay guys, like deep cervical related to head, neck and oropharynx. Supraclavicle is related to the hemothorax, abdomen and pelvis, and the right side is right hemithorax. It's the important point for it is happening below the all of them. First, you can check the dark color. That dark red color already maintain the light lymphatic that drains right side of body up of the diaphragm into the junction of right subclavian internal jugular vein. That the right side above the diaphragm. The right side above the diaphragm will be going to drain into right lymphatic duct, and it is junction of right subclavian and internal jugular vein. Okay, but over the other lymph node is going to drain in the thoracic duct. In the thoracic duct, and it's below the diaphragm and left thorax, upper limb, and it is going to in the junction of left subclavian and jugular veins. And there's one MCQ is important is there. If the rupture of thoracic duct is happening, what is going to happen to the chylothorax? The chylothorax, rupture of thoracic duct going to, so chylothorax, the chylum in the lymph. The lymph will be in the thorax region, like pneumothorax. Okay, the air in the thorax is same like that. And these are important, like the para-aortic, you can remember like the para means the pair of testes, ovaries, kidney, fallopian tube, and the fundus for uterus. And they also, one of their the important thing is that the celiac artery cover liver, stomach, spleen, pancreas, upper duodenum. Seeing the celiac lymph node is going to cover these organs. Seeing like superior mesenteric from lower abdomen to colon to splenic flexure. Inferior mesenteric colon to upper rectum. The same as the blood supplies there. And this is very important. The para-umbilicus system Mary Joseph known is just an indication of gastric cancer. Okay. Please rememberize this by palpating your own lymph nodes by the sequence. First, they will be submandibular, then deep cervical, supraclavicular, mediastinal, hilar, axillary, epitocular, from the abdomen, celiac, superior mesenteric, then para-umbilical, then inferior mesenteric, then para-aortic, external iliac, internal iliac, superficial inguinal, then preauricular.